Hello and welcome to our channel. Today we're going to explore two important and often confusing topics in the world of digestive health: Crohn's disease and ulcerative colitis. These are the two main types of inflammatory bowel disease, IBD. If you've ever wondered what sets these conditions apart, how they're diagnosed, or what treatments are available, you've come to the right place. Let's dive in. First, let's define what Crohn's disease and ulcerative colitis are. Crohn's disease is a type of IBD that can affect any part of the gastrointestinal (GI) tract, from the mouth to the anus. However, it most commonly affects the end of the small intestine, the ileum, and the beginning of the colon. Crohn's disease can cause inflammation through the entire thickness of the bowel wall and can affect multiple segments of the GI tract, leaving healthy areas in between. Ulcerative colitis, UC, is another type of IBD, but it specifically affects the colon and rectum. Unlike Crohn's disease, the inflammation in ulcerative colitis is limited to the innermost lining of the colon and is continuous, without the healthy patches seen in Crohn's. What causes Crohn's and UC? The exact cause of both Crohn's disease and ulcerative colitis is unknown, but several factors are believed to contribute to their development. Genetic factors. Family history. Both conditions tend to run in families. If you have a close relative with IBD, your risk of developing it is higher. Genetic mutations. Certain genetic mutations are associated with a higher risk of developing Crohn's disease or ulcerative colitis. Immune system response, autoimmune reaction. In both conditions, the immune system mistakenly attacks healthy cells in the GI tract, causing inflammation. Environmental factors, diet and lifestyle. A diet high in fat or refined foods, smoking, and stress may contribute to the development of IBD. Infections. Previous infections may trigger an abnormal immune response, leading to chronic inflammation. What are the symptoms? While Crohn's disease and ulcerative colitis share some common symptoms due to their inflammatory nature, there are key differences in how they manifest. Common symptoms include diarrhea. Both conditions often cause chronic diarrhea. Abdominal pain and cramping. Pain can range from mild to severe and is often located in the lower right abdomen in Crohn's and the lower left in UC. Blood in stool. This can occur in both conditions due to inflammation and ulceration. Fatigue. Chronic inflammation and anemia can lead to significant fatigue. Weight loss. Malabsorption of nutrients and loss of appetite can result in weight loss. Symptoms specific to Crohn's disease include fistulas, abnormal connections between the intestine and other organs, abscesses, pockets of infection in the abdomen, strictures, narrowing of the intestines due to scar tissue, perianal disease, pain and drainage around the anus. Symptoms specific to ulcerative colitis include rectal bleeding, more common in UC due to inflammation of the rectum. Urgency to defecate. Frequent and urgent need to have a bowel movement. Tenesmus, a feeling of incomplete evacuation after a bowel movement. How are Crohn's and UC diagnosed? Diagnosing Crohn's disease and ulcerative colitis involves several steps and tests. Medical history and physical examination. Family history. Information about relatives with IBD or other autoimmune diseases. Symptoms. Detailed description of symptoms and their duration. Laboratory tests. Blood tests. To check for anemia, inflammation markers like C-reactive protein, and signs of infection. Stool tests to rule out infections and check for blood or inflammatory markers. Imaging studies. Colonoscopy, a key diagnostic tool where a long, flexible tube with a camera is used to view the entire colon and terminal ileum allowing for biopsies. Endoscopy, used to examine the upper GI tract if symptoms suggest involvement above the colon. CT or MRI scans. These can provide detailed images of the GI tract and identify complications such as abscesses, fistulas, and strictures. There are differences in diagnosis. With Crohn's disease, diagnosis is based on findings of patchy inflammation, deep ulcers, and involvement of the entire bowel wall, often with the presence of granulomas on biopsy. In ulcerative colitis, diagnosis is based on continuous inflammation starting from the rectum and extending proximally, with inflammation limited to the mucosal layer. How do you treat Crohn's and UC? The treatment goals for both Crohn's disease and ulcerative colitis are to reduce inflammation, manage symptoms, and achieve and maintain remission. However, treatment strategies can differ due to the nature of each disease. First, there are several medication protocols. Anti-inflammatory drugs such as aminosalicylates, 5-ASAs, used mainly for mild to moderate UC. Examples include mesalamine and sulfasalazine, corticosteroids, used for short-term control of moderate to severe flare-ups in both conditions. Examples include prednisone, budesonide. Immune system suppressors include thiopurines, azathioprine, and mercaptopurine are used to maintain remission in both conditions. Methotrexate, often used for Crohn's disease. Cyclosporine, sometimes used for severe UC that doesn't respond to other treatments. Next, there are biologics. These are a type of medication derived from living organisms, such as bacteria, yeast, or mammalian cells. They are used to treat a variety of conditions, including autoimmune diseases, by targeting specific components of the immune system. Unlike traditional drugs, which are chemically synthesized, biologics are complex molecules made from living cells through highly controlled and sophisticated manufacturing processes. Biologics include TNF inhibitors are used for moderate to severe cases of both Crohn's and UC. Integrin inhibitors used primarily for Crohn's disease and interleukin inhibitors used for both Crohn's and UC. Lastly, there are other medications such as antibiotics, sometimes used to treat or prevent infections and complications in Crohn's disease. Anti-diarrheal medications may be used for symptom relief in both conditions. Pain relievers, such as acetaminophen, is preferred over NSAIDs, which can worsen symptoms. Can you treat Crohn's and colitis naturally? Lifestyle and dietary changes can be very helpful in the treatment of both Crohn's and UC. Diet and nutrition include low residue. Diet helps to reduce bowel movements and ease symptoms. Elimination diets, identifying and avoiding foods that trigger symptoms. Nutritional supplements, to address deficiencies, particularly in Crohn's disease. Stress management practices include techniques such as yoga, meditation, and counseling to help manage stress, which can exacerbate symptoms. Finally, there are surgical options. For Crohn's disease, there are resection, removing diseased segments of the intestine, strictureplasty, widening narrowed sections of the intestine, fistula repair, surgery to repair abnormal connections between the bowel and other organs. For ulcerative colitis, there are proctocolectomy with ileostomy, removal of the colon and rectum with creation of an ileostomy, J-pouch surgery, creation of a pouch from the end of the small intestine attached to the anus, allowing for bowel movements through the normal route. Now that we've covered the different treatments, let's discuss other important factors in living with IBD. It will require ongoing management and lifestyle adjustments. follow-up appointments, regular visits to the gastroenterologist to monitor disease activity and adjust treatments, screening for complications, including colorectal cancer screening, as IBD increases the risk. It is important to have support systems. Support groups, connecting with others who have IBD for shared experiences and support. Mental health. Counseling and therapy can help manage the emotional impact of living with a chronic illness. Hearing from individuals who live with Crohn's disease or ulcerative colitis can provide valuable insights and encouragement. Many people find ways to manage their conditions effectively and lead fulfilling lives. Crohn's disease and ulcerative colitis are chronic conditions that require careful management. While they share some similarities, understanding their differences is crucial for accurate diagnosis and effective treatment. Advances in medical research continue to improve the quality of life for those living with these conditions. Thank you for watching. If you found this video helpful, please give it a thumbs up and don't forget to subscribe to our channel for more informative content. If you have any questions or topics you'd like us to cover in future videos, leave them in the comments below. See you next time!